So through the FCTC 2030 project, we've worked with more than 30 lower middle income countries to help them to deliver their tobacco control priorities. And the project has helped with a number of different achievements that the governments have made across the Framework Convention on Tobacco Control.
So UNDP is assisting countries through the FCTC 2030 project in a number of ways. And one of them, and a big area of our support, is around governance, so tobacco control governance, health governance. Article 5 of the Framework Convention on Tobacco Control obligates parties to put in place national comprehensive strategies and plans for tobacco control, as well as national coordination mechanisms that bring together different sectors. So UNDP provides technical support around these two areas of governance specifically.
So we received a lot of support from the FCTC 2030 project. The first one is, of course, we made a work plan according to the FCTC 2030 project, and all the activities now on the work plan, we got support to, even though it's in draft, we are preparing all the activities to be done at least end of this year or next year.
No one was focusing on tobacco. So after this project has started, now the country is now being taught on the negative impact tobacco has to the country. Yes, so that's one thing that we as a country we are looking towards, that everyone gets to know about tobacco so that everyone can play their part. And the Ministry of Finance also plays its part, and other ministries which are part of the stakeholders involved in the implementation of the FCTC 2030. The FCTC 2030 project has given funds that we were able to hold workshops where there were trainings and where we were able to get expert assistance from the Knowledge Hub. For example, we were able to be trained on how to do tax administration or to put the right tax policies towards the taxation of tobacco, which is much better than what we had done before the knowledge. So now that we have been capacitated, we are working towards amending the legislation so that the aspects of the legislation that were lacking, we will include them in the taxation of tobacco.
We have very big challenges in our country because our culture and in our nation is to use tobacco. That challenges are communication with tobacco industry about new measures to protect health of our nation, our citizens. And it's very important that we have support of FCTC, WHO, in any kind of interventions for our country.
This is, I think, the main activity of the FCTC, that to collect information from success stories and to bring it to other countries to see the impact of this kind of activities.
Ghana has also been able to develop a tobacco control strategy for the next 5 years, and it's contained a national plan and action plan, which is going to give directions to tobacco control activities in the next 5 years.
One of the first achievements within the project was creating investment case, And in general, evidence generation is a great achievement, as well as establishing partnerships, awareness raising, and advocacy. Also, we have developed policy options throughout the help of FCTC project with the technical support from experts. Outside the project, in order to continue sustainable tobacco control in the country, we have also established a state program where Georgia is continuously monitoring the enforcement of the successful legislation, as well as we have created free of charge quick line. And this is also maintained within the state program with state budget.
The second major challenge is budget allocation for tobacco control activities in the country. So we do not have dedicated funds, so that makes it somehow difficult to be able to really implement. Had it not be FCTC 2030 project funding, it would be very difficult in implementing this key target that we have.
The project supported tobacco control measures in the country, and especially law enforcement, and assisted in promoting upcoming policy measures. And furthermore, as a new intervention in the country, we concentrated on initiating sustainable livelihoods for tobacco cultivation.
We have to work in few other areas that we need to go ahead rather than as we did since a long time. So as I have already mentioned, that especially in the plain packaging. So this is the area that we have to work, and the taxations, because we need to increase the taxations against the tobacco.
But again, with the FCTC, it being helping with the community, we think when we work well with the FCTC project, especially further engagement with the parliamentaries, that would be very important, as they are the ones that would meet a lot of people, and many people would always refer to them or would really follow or adhere to what they would say. So engagement to the parliamentaries on how would tobacco control be important on the health, or how would it important, and what are the effects in tobacco control into economy or into environmental perspective. All these kind of scenarios would better help the parliamentaries, as in finding the cases that they could better put in the government, but also tell to people that how best to reduce or to less consume the tobacco.
La asistencia técnica que brindó el proyecto FCTC nos permitió hacer dos propuestas de reforma de ley. Una para la ley de control de tabaco y la siguiente para hacer la reforma de los impuestos. De esta forma se ha preparado las propuestas de reforma hacia la Asamblea Legislativa y que estas están en un proceso de análisis.
Bueno, el proyecto FCTC nos ha ayudado mucho en la parte de la asesoría para llevar los temas en el tema de salud pública, en la vanguardia. Uno de la asesoría fue cuando se realizó la abogacía de la ley 315. En ese entonces no teníamos ley, gracias al proyecto FCTC. Se fue adaptando todos los métodos técnicos que nos brinda el convenio marco, y fue uno de los motivos por la cual también, y con ayuda de las personas claves, se llevó a cabo la sanción de la ley 315 a nivel nacional.
The best examples that I can give around the FCTC project is the first one being an investment case that has been supported through the FCTC project. Fiji is still a long way away from actually getting the investment case approved, but this provides us with an opportunity, with evidence to support our tobacco control activities. The second example would be the support around capacity building in enforcement, and looking at training our workforce to carry out enforcement and tobacco control in communities, in the public, so that we strengthen our activities in this space.
Con la implementación del proyecto, el país logró disminuir un 30% el consumo de consumidores, que en datos epidemiológicos significa bajar de una prevalencia de 8.6 a 5.3 y además que significa 1.2 millones menos de consumidores.
Les exemples, c'est surtout par rapport au sevrage tabagique en Tunisie. Donc, nous avons des consultations d'aide au sevrage tabagique qui ont noté de très bons résultats.
One of the examples I will provide today will be about how we work at the country level, notably over the past 5 years in sub-Saharan Africa, providing assistance and guidance to civil society organizations to include the FCTC in their development plans and linking that back to the Sustainable Development Goals, and also to lobby effectively for increases in tobacco taxation. Both of those pieces of work that we've been doing with these countries have led to major progress as the civil society organizations work alongside government. And these are some of the objectives as well of the FCTC 2030 project.
So tobacco control is about a human touch. It's about health agenda. It can be about an environment agenda, and it also is very challenging because it has an economic agenda as well. I think one of the key lessons is you need to have the highest level of government actually committed to tobacco control activities. If you have the support, the political will, if you have the manpower and the mandate, you will be able to achieve a little bit at a time, and over a long term you'll be able to gain a lot.
The FCTC 2030 project has been vital for countries like ours to advance our policies and the implementation of the same. And it is because of their support and the assistance that we have got that we have moved forward to take effective measures in combating this crisis.
Com certeza, é claro que estamos numa fase de aprendizagem, mas também temos, sim, experiências que podemos partilhar. Relativamente ao projeto 1, já estamos a finalizar esse projeto e dentro desse projeto há várias questões. Em Cabo Verde temos experts em matéria de tabaco com conhecimentos que podem partilhar a nível sul-sul, mas também a nível regional, por que não?
The FCTC 2030 project has been extremely helpful to start off the work on tobacco control quite intensively, and also to seize the moment. Within the frame of the project, Tobacco Control Group has been established in the National Center for Disease Control and Public Health, and the group still continues to work on tobacco issues, even though the FCTC 2030 project in Georgia is closed at the moment.
So we've had, as I say, more than 30 countries participating in FCTC 2030 so far, receiving the support that we're able to offer, financial resources, technical assistance, but also political and stakeholder engagement to encourage stakeholders at the country level to do more for tobacco control. So with the success that we've had so far with FCTC 2030, we hope that we're going to be able to continue to deliver this support to lower middle income countries to help them to do more to tackle tobacco use in their countries.
FCTC 2030 project is our main way of providing direct assistance to the parties, to the convention, and now also for the protocol. This has been made a reality because of generous contributions from some of the parties, Especially at this moment, we can say that the United Kingdom, Norway and Australia are the main donors for this project, and really it's very important for us if we can have other donors that join this, because as a multi-donor project, they will be very useful for us to provide all the resources that countries need.